Thank you for joining us today. My name is Aline Sigler. I'm a specialist with Provider Outreach and Education at WPS. Assisting me behind the scenes is my friend and co-host, Tom Ryan. Today's session, as you can see here, is about submitting credit balance reports in the WPS Secure Net Access Portal. We affectionately call that SNAP. Being Medicare contractor, we use acronyms also, but this is the secure side of our website. We have all varieties of experience on the line, so this may be something that you're very familiar with, but we realize we may also have some of you who are brand new to Medicare, brand new to using the portal, not even aware that we had a portal. And so we want to make sure that everybody has a clear understanding as much as possible. We also want to make sure that you're aware that credit balance reporting is strictly a Part A function. So meaning those of you, facilities and institutional providers that submit claims on the UBO4 claim form or the 837I electronic equivalent. We realize those of you that are Part B providers, the ones that bill on the CMS 1500, you also may have overpayments that you need to report. It's a different process, and so we just want to be clear that this is a Part A function. A couple small items of housekeeping. We hope you're using our training center on the public side of our website. We post the event materials for webinars there. So if you want to download a copy of this slide deck, you can find it there on the live events section of that training center. This is also where you can find out about and register for upcoming educational activities. That may have been where you went to sign up for this webinar, or someone may have forwarded the link to you. So we just want to make sure, again, that everybody understands where to go to find a list of the upcoming education so that you can register for things that are beneficial to you. We are recording this event. We record all of our live webinars, and we have an encore presentations page for anyone who may have missed the live event, maybe you had a scheduling conflict, or you want to review the material again. Depending on the number of events that we have, because we do a lot of them, they will normally be on that page for 60 to 90 days. You can also find them on our YouTube channel. Use the chat feature to add any questions that you have that are related to today's topic. At the end of our prepared remarks, we'll take as many questions as possible, and then you'll also have an additional way of sending questions in after the webinar. We hope you'll take the opportunity to give us your feedback. You know, whether you're listening live or you're listening to the recording, we value your feedback. Your survey results give us insight into how we're doing, what we could do better, and the types of education that you find most beneficial. This is our disclaimer, and it's just to let you know that Medicare does change sometimes. So if there's ever a discrepancy between what's in our educational material and what CMS has on their website, you always want to look to CMS for the final word. And then finally, we don't allow recording of our educational events for profit-making purposes. No screenshots. We're recording it for you, so there really wouldn't be any need to that. But these are CMS's guidelines, and we just want to make you aware of them. During this session today, we're going to examine CMS's definition of a credit balance. And then we're going to walk through the steps to submit a report using the Secure Net Access Portal. We'll talk about how to search for a report after it's been submitted, to find the status of the report, and we're also going to highlight some of the recent changes that impact credit balance reports, and then we'll end with, like we often do, with some resources, places where you can go to get even more information. Medicare is full of acronyms, so we always want to refer you back to a list of acronyms. Some of them you're familiar with, some of them you may not be. Instead of listing all the terms on every slide, since we have a limited amount of space, we're giving you this list to refer back to. These are the ones that I specifically used when I created this presentation, or that I know that I'm going to say during our time today. So let's begin by looking at how CMS defines a credit balance. You know, a lot of times we jump right into telling you what to do or how to do it, but we leave out that why. So let's back up a bit. Yesterday, I held a training session that talked more in depth about credit balance reporting regulations, and we walked through the required elements of the CMS 838 form. The 838 form is the actual credit balance report. Many of you may have attended that session. If you're listening to me as an encore of this presentation, I'm also going to put a link in the description of the video, and so you can look at that if you want to. Or you can do a search for Encore Clarifying Credit Balance Reporting. That can also help you find that previous session if you're interested. A credit balance is an improper or excess payment made to providers as the result of either patient billing or claims processing errors. This slide contains some examples of Medicare credit balances. So it includes instances where a provider is paid twice for the same service. We would think that that wouldn't happen, but sometimes it does. And that could be that you were paid twice by Medicare, so it's a duplicate claim, or you were paid twice for that service, once by Medicare and once by another entity, whether that's a person or another insurance company. You know, maybe you were paid for services that were planned but not performed. You had everything set to go. Your system thought that those services or that item was provided, and for some reason or another it wasn't. And so now you have this outstanding credit. Maybe you were paid for something that Medicare doesn't cover. You know, we do have lots and lots of edits built into the system that should catch non-covered items and services and prevent them from paying, but that doesn't always work. It is still your responsibility to bill properly. Maybe it's something that Medicare does cover, but just not for your specific patient in this circumstance. That does happen sometimes. A credit balance could be an overpayment because of errors made in calculating the beneficiary's deductible or coinsurance that was due or that you thought was due. A hospital that bills and is paid for outpatient services that should have been included in the inpatient claim due to hospital bundling or the 72-hour rule, the 3-day payment window, those types of situations. Those are just examples of things that could generate a credit balance within your system. So then what steps are we going to take to submit a credit balance report in the portal? If after looking at your accounting system and things like that, what we're going to do is we're going to look at Medicare's regulations. We're going to determine that you do need to send a credit balance report, whether you send it electronically or via SNAP. So that's what we're going to look at next. if you're not a registered user of the SecureNet Access portal, whether it's because you're new to Medicare, you didn't even know that we had a secure portal, or you were hesitant because you weren't sure if it was worth the effort, having one more system, one more logon, whatever the case. This is just one of the many tasks that you can actually get done quickly, easily, and free of cost. So I do encourage you to reconsider being a registered user of SNAP. On the WPS website, near the top of every page is the area to log in or register. And I included a screenshot of it here. So here you have your user login and password, or the ability to register right here. There's also a link to the portal user manual, as you can see, if you want to research a little bit more about the portal before you decide. Okay, the first step is to sign in or sign up, or sign up and then sign in. For those of you who don't know, there are 3 different levels of access within the portal. We have eligibility, standard, and administrator. The ability to submit a credit balance report is for standard users and NPI administrators. If you are eligibility only and credit balances is one of your duties, talk to your NPI administrator and request a different level of access. The screenshot here is an example of the homepage of a standard user. So if yours looks a little bit different, you're either eligibility only or you're an NPI administrator and you have even more tasks that you are capable of. This is just an example. So from your home page, navigate to practice. So if we go back here, you see all these different titles, and I apologize, it's just a little bit blurry, but these different tiles have different tasks involved with them. You see they all have a different color too. So practice is the first one, so that's easy for us. So you're going to navigate to that practice section or tile, and then you're going to use the plus sign, and I've got it highlighted here in red. You're going to use that plus sign. Plus means add, so add, create a new report. The credit balance button, you would think that that's what you would be drawn to. It's bigger, it has the words, that sort of thing. So I want to differentiate the difference between those 2 buttons and which does what. Later when we talk about searching for previous reports, we're going to use the actual credit balance report button. But to add a new one, use that plus there. Okay? Once you do that, then the credit balance report page will open. What you want to do is select the appropriate NPI from the Part A service location dropdown. So this first box where it says Part A service location and then in parentheses NPI, that's going to be a dropdown. That's going to give you a list of the NPIs that you have access to based on your responsibilities and what was assigned to you within the secure part of the portal by your NPI administrator. You're going to select that. Then the registrant name and email address is going to auto-populate based on your login information. Once again, the credit balance feature is available to Part A providers. So if you have access to Part A and Part B NPIs, if you select a Part B NPI, then you'll receive an error message reminding you that this is a Part A function only and to choose a different one. Next, you're going to enter the name and title of your provider's officer or administrator that's certifying the credit balance report. The contact information that you see under that, and we have it blurred out to redact information that may have been PHI or PII there. It's going to populate with what's on your My Profile page. So if this should be someone else, then you can change it at that time and enter the correct information for the contact in the appropriate fields there. The next step is to select the fiscal quarter end period based on the CMS credit balance report due dates. If a credit balance is identified and due in a certain quarter, CMS requires the report to be submitted within 30 days following the close of that calendar quarter. Now, before I have anybody that gets up in arms, I know that mandatory quarterly credit balance reports are no longer required. And we're going to talk about that in just a few minutes. What I'm doing here is just merely reiterating that the requirements for reporting if and when a credit balance is identified and due and reportable, I just want to be clear that there are still some of these guidelines in place if you need to submit a quarterly credit balance report, okay? So now you're going to let us know the action that you need to take. You're going to select the radio button indicating that you need to fill out a detail page. So you see you have 3 choices here. Those other 2 options that are listed, since you're no longer required to submit the credit balance report every quarter, those other 2 choices are kind of irrelevant at this point. The online form that we have in our portal follows the current paper 838 form. So if that is revised in the future, as I'm sure it will be, the portal will then also change to mirror that. If you're familiar with the 838 form, what we have covered so far corresponds to the certification page and the header section of the details page. There's a link to the hard copy form and the instructions on the resources slide. The resources slide is toward the end of the slide deck. So if you want to compare the actual 838 form to what's in our portal, you can certainly do that. To add your claim information, so if this were an instance where you had credit balances that you needed to report, and you marked the button saying that you needed to add claim details, then it's going to open the forms where you're going to be able to do that. So you're going to click on, there'll be a plus add line button, and then the page is going to expand with those additional fields to complete. So we're just going to go right down the form, and I've kind of blocked it out because I know that it's not all going to fit on one slide. So I've kind of divided it up, but when you're in the system, I'm just going to start at the top and go right down so that you know what to expect. So starting with the beneficiary's first name and last name. On the paper form, you do the last name and the first initial. Within the portal, it asks you for first name and last name. Then you're going to add their Medicare ID, which is their Medicare Beneficiary Identifier, or MBI. You might call it the Medicare ID, you might call it the Medicare number, but that is the number that's assigned by Social Security for Medicare purposes. It's not their Medicare Advantage number, it's not any other number that's maybe how they're registered in your individual system at your facility. This is their Medicare Beneficiary Identifier. Next, we need the claim number. So this means the internal control number, or the ICN, that's assigned when the claim is processed. If your credit balance is the result of a duplicate payment, report the data pertaining to the most recently paid claim. There's a button where you can quickly verify the claim number. And if you can see that, it's right here. So if you need to make sure if there were, maybe this is one of those problem situations where you have multiple claims for the same data service for the same beneficiary. If you need to verify that, you can use this button to go into the claim history for this patient and verify that claim number. Continuing on down the form, you're going to enter the type of bill for the claim that's going to match what you have on your original claim. So 111 for inpatient, 131 or 851 for outpatient, 831 for ambulatory surgery, etc. I've been asked, is that 3 digits or 4 digits? Officially, a type of bill is 4 digits with the first digit being a 0. You can do it either way. You can put 0131 or you can just put 131 and it's fine. Moving on, the dates. The dates the beneficiary was admitted and discharged if your claim's an inpatient claim, or the claims from and through dates if it's an outpatient service that spanned more than 1 day there, or those 2 days may be the same. So admit to discharge or from and through dates. This is followed by the date the claim was paid. So we need to know what date that claim paid on. And then you have the calendar icon where you can select that date. Other items that are required, you see here, you're going to select whether the cost reporting period is open or closed. And to clarify, an open cost report is one where a Notice of Program Reimbursement, or NPR, has not yet been issued. You don't want to consider a cost report open if it was reopened for a special situation. Maybe to report graduate medical education or malpractice insurance. If you aren't sure which one to mark, inquire with others at your facility or at your office that actually are involved in the cost reporting process if that's not you. Next, you're going to let us know the amount of the Medicare credit balance as determined from your patient or your accounting records, and the amount of the Medicare credit balance that's being repaid with the submission of this report. Following that, we need to know the method of payment. So that's the bottom section of this portion of the form, the method of payment. And if you're familiar with the paper 838, this is a column on the form where you're actually adding these letters to tell us how you intend to repay that money by submitting the report. So C is for check. A is for a paper adjustment, and you would attach that to your submission. Z is for a combination of check and hard copy adjustment, or X if the adjustment bill's already been submitted, either electronically or hard copy. And this is important so that we don't take that money back twice. We don't want you to send a check and we do an adjustment. Of course, we can fix that, but it's just going to hold things up and take more time. So be clear in how that's going to be repaid. The remaining fields are what you're going to use to tell us the amount of the credit balance that remains outstanding. When would this be a situation? Well, this might be a situation where, because we have exceptions in the Medicare world, for Medicare secondary payer claims. If there's an overpayment identified because of Medicare being the secondary payer, CMS rules, actually Social Security rules within the Social Security Act, make you repay that amount within 60 calendar days. So depending on when that overpayment is identified, it may be that it falls into your credit balance reporting period, but then you're not outside of that 60-day window. So this amount will usually be zero, but it may not always be zero, okay? Then we need to know the reason for the credit balance. So you're going to select 1 if it's the result of a duplicate Medicare payment, 2 if it's a primary payment by another insurer, or 3 other reasons. If you choose 2, then the next set of data relates to the other insurance. You're going to select the value code from the dropdown that matches the type of insurance it is. If you bill Medicare and you have Medicare secondary payer situations, these are the same value codes that you use when reporting primary payments. 12 for working age, 43 for disability, 15 for workers' compensation, and so on. We also need to know the name and address of the primary payer. So the bottom set of criteria is for that. Excuse me. So you're going to put in the primary payer's name, whether it's a business or an individual. Then the address, including the city, state, and the zip code. Once all that required information is entered, and just so you know, like most other claim forms, anything with an asterisk is a required field. And if you leave it blank, you're going to have an error at the end when you try to send it. But once all that information is entered, you're going to click Save down here at the bottom. And I know it's just a little bit blurry, but we have a Save button. If you need to go back and change something, start over, there's also a Cancel or a Clear button if you need to start over. So once you click that Save button, then the claim line is going to display, and you have the option to, there's an eye, like an actual physical eyeball looking icon if you want to view it, pencil if you need to edit it, or a trash can if you need to delete it. If you have more than one credit balance to report, you can click on the plus add item or the add line, and an additional form will appear for you to add more. Add row, plus add row. Once all the rows are entered and complete, find and upload any necessary attachments. Some of the attachments you might have are listed here. This might be an adjustment claim, an explanation of benefits from a primary insurance, a portion of a remittance advice, or any other supporting documentation. The portal is going to prompt you with the file types and the size restrictions for your reference, and so that's what this box says here: accepted file types, individual file size cannot exceed, and so on. Next, you're going to get a statement asking you to certify that the information is correct. You'll complete the electronic signature, and then you'll click Review. So this blue button down at the bottom, Review. If everything is correct, you're going to click Submit. If you need to make changes, you can click Cancel to clear the form and start over. Once you do that, the page will refresh, and it'll display a message indicating that it was successfully submitted. It's also going to give you a tracking number and details of the credit balance submission. So it's going to look similar to the examples shown here. Obviously, we have blurred out the specific information because that wouldn't be a good thing to show everybody, but that's just an example of what that page might look like. So after submitting your credit balance, you'll undoubtedly, at some point, you'll want to check the status of it, or perhaps you need to go back and look at a credit balance that was submitted in the past. And so that's what we're going to talk about next, searching for a report. As before, you're going to start on your home page after you log into the portal. Under that same practice heading, this is where we're going to use that other button. You're going to click on the larger credit balance report button. We use the plus sign to create a new report, and then the one on the left is going to be to review a prior report. The search screen will display a listing of all the credit balance reports that have been submitted. And then what you can do is refine that search using some of the items that you see listed here. You can choose an NPI. So many of us have multiple NPIs that we work with and are responsible for. You can change that. You can filter and only look for certain facilities. You can search by tracking number. You can search by the submission from or to date. The status of the report. So if you only want to look at the closed ones, you only want to look at the ones that we've received or ones that you've sent but haven't been marked as received yet, you have those choices there of the different statuses to filter those search results. You can also filter by PPAN or fiscal year end. You can enter specific data in the type to filter results field, and that's in this lighter blue right here in this area. So if there's a specific, I don't know, term, amount, insurance, something that appears on the report, you can try to search for it that way. So I hope going over the actual steps that we've shown you, how to, submit that report in the portal. It's pretty straightforward, and I hope that that helps encourage you that if you do need to send a credit balance report, that the portal is quick and efficient. You get an instant confirmation that it was sent, things like that. So hopefully that's helped you. As I mentioned earlier, and I know several of you submitted questions related to this during the registration process, there have been some recent changes in the credit balance reporting world, and so we want to go over those today as our final topic. If you've been around the Medicare world for a while, or you've maybe heard horror stories about it, you know that Part A providers were required to send credit balance reports quarterly, regardless of whether or not they had any credit balances to report during that quarter. So a lot of times you were submitting a report to tell Medicare that you had nothing to report. And it took some time to get that changed in the Medicare world, but that has been changed now. And if we didn't receive your mandatory quarterly credit balance report within 30 days following the end of the quarter, your payments were withheld until we did. So again, it took some time for you to submit those reports. It took time for us to receive them, process them, especially when we were receiving paper reports, whether that was by mail or by fax. And so it just wasn't efficient. So that all changed as of December 1st, 2024. Mandatory quarterly credit balance reports are no longer required. Now, this doesn't mean that credit balance reports or that process has gone away. It hasn't. It's just that you only have to use the credit balance report if you have a credit balance to report. This would be ones that you haven't taken care of in any other way, whether that be canceling a duplicate payment, adjusting a primary payment, any of those things. You should not hold a credit balance just to submit it on the report. We still encourage you to continue to adjust and to take care of overpayments as soon as they're identified. We have an online form also called the Overpayment Notification/Refund form that you can use. And I did include a link to it on this slide if you want to take a look at it. So that's also something you can do as soon as an overpayment is identified, rather than wait for the credit balance report. So here's the resources slide that I mentioned earlier. These are some places where you can go to find out more about what we've covered today. The first one is an educational article from the WPS website. It contains the submission guidelines and contact information. So let's take a look at that quickly now on the WPS website. Now remember, this is a Part A function. So if you work with Part A and Part B, you want to make sure that you select a Part A jurisdiction, whether you're J5 or J8. If I select a Part B, and I'm going to do that just for example, this is the first time I've been to our website today. So it says right here, this resource applies to J5A and J5A. You selected J5B. So it's notifying you that, hey, this is just for Part A, so I'm going to go up and I'm going to switch that over to Part A. So this tells you a little bit about the changes effective December 1st, 2024 that I told you about. And then it goes on to talk about the different submission methods. We do still accept faxes. You can still mail it. Who to contact with questions. Your customer service number will be different if you are J5 versus J8. And then it goes into what's required. I know specifically today we're talking about the portal, but I just wanted to reiterate that we have some additional information on our website. And also to illustrate, like I said, on every page of our website, here's your access to SNAP right here. You're going to log in or you're going to register, and here's a link to the manual. Okay? Just wanted to make sure that everybody was aware of that. Now, the second resource that we have here, this is the portal user manual. So I just showed you how to find that. But if we open that up, there is a section specifically for the credit balance reports. You can download the entire manual, or you can just jump to the section that you need, whatever your preference is. And this closely follows everything that we talked about today. You know, since this is potentially only a quarterly task that you'll have to do, or even spread out further if you don't have any credit balances to report in a specific quarter. I know a lot of you won't. I don't want you to feel like you have to memorize this process. You can go right out here to the manual and walk through these different things that we just talked about to help you navigate that section of the portal to get that done. Now, the third resource is the actual 838 form. So I'm going to go to the CMS website for that. And what you can do is go to Medicare, and then you're going to scroll down to Forms and Notices. And once we click there, You can see a link to all of the different resources related to forms. But what I like to do is I'm a searcher rather than a navigator. Now, there is a link on the actual PowerPoint itself, but if you find that you're not in that PowerPoint and you need to take a look at it, all you have to do is search. It comes right up for you. You can download it, and then you'll actually see the certification page, the detail page, and all the instructions regarding it. Now, I do anticipate that this will be updated soon based on the changes that were made as of December 1st, so you'll want to be watching for that. But if you're interested in comparing the paper form to the portal, you'll see that it follows the same process and gathers all the same information. Now, this last resource that I have for you, this is actually a link to the Medicare Financial Management Manual. And specifically, Chapter 12 is where you can find the requirements for credit balance reporting for not only providers, but also MACs. So if you're interested in going back even a little further, and where does it say I have to do that? Where does it talk about the 60-day requirement for repaying MSP overpayments, things like that? You can find them in that CMS manual. So now what I want to do is I want to pause here, and I want to see what kind of questions you have related to this topic. Anything that is claim specific or pertains to a specific credit balance report, unfortunately, I wouldn't be able to help you with that because I can't see them. I don't have access to look at the portal with you, and so those questions would actually need to go to customer service. I'm going to check in with Tom and see what you've got for me.
First question, who can do electronic signatures? If it is the authorized signer only, how do we get them to sign?
Well, if they want to submit the credit balance report on their machine, that's fine. Otherwise, we have, they might have the capability where you can use their electronic signature. I'm not sure how those permissions are done within your office or within your facility. So that's something that you would have to discuss with that administrator or that CFO or CEO, because literally each one of you may have that task outlined differently in your offices.
Next question is, where do you mail the check?
If you are going to mail a check, you're going to send it with your credit balance report. So let's go back to our website, and let's go back to that article that we talked about with the credit balance reports. Again, I am a searcher, not a navigator. And within that article, if you are sending a check with your credit balance report, here is the mailing address that you're going to use right here. Now, a check should be your final option, because there are so many other ways to either adjust, cancel, do that electronic overpayment form that I showed you. So an actual paper check should be your last option. Next question.
That was the last question.
Great. Well, thank you for those great questions. I'm going to go back to our slideshow here. Have a couple more things to show you. Get back to where we were. And the first thing is that in a few minutes, within the next 15 or 20 minutes, you're going to receive an email to thank you for attending. I just want to make you aware of it, because if it goes to your junk or it goes to your spam folder, if you need contact hours for continuing education units, This email is actually going to have that for you. So it's going to look similar to what's on your left here. We have the certificate of achievement information down here. Email is going to have your name. It has the title of the course you attended, the date, and the contact hours. So your accrediting body probably has a mechanism for you to save and upload this information for consideration for CEUs. Another thing is that it is a different option for taking the survey. We want your feedback so badly that we've given you multiple ways to do that survey. And so this is just one of them. If you don't see it after you check your junk or spam filters, make sure that you add the WebEx email address to your safe sender list. And for those of you that are listening to this education as an encore, we thank you so much for your interest in our education, but unfortunately, we don't have a way to verify your attendance, and so no certificate is possible in that instance. You also have the ability to send us questions, and you can do so for 1 week from today. You can send a follow-up question to our education mailbox, the same one where we referred you to if you were having technical difficulties early on. And then what you're going to do in the subject line, put something about credit balances or credit balance reports. That way, those questions will get sent directly to me, and I can get an answer for you. So 1 week from today, you have that capability. And then, please take a few minutes to complete a survey about this course. Tell us what you liked. Tell us what we could do differently. Give us suggestions for future education. We value that feedback. We look at it, CMS looks at it, because we're continually trying to do better for you. You have a few options depending on what your preference is. You can use the link in the chat. You can use the link that comes in your thank you for attending email. Or when you exit the webinar, you'll be asked to go to an external site. And that external site is the CMS Qualtrics page for the survey. And that message is going to look kind of like this bottom box here. It's going to have the triangle. It's going to say external site, and it'll have the blue continue button. This verbiage here, which we cannot change, may not give you an indication of what the external site is or what it's for. So we're trying to explain that to you so that you know that it is safe and it's just for the survey there. If you're listening to the encore, at the end of the video, a graphic similar to what's shown here with the hand and the stars, that's going to be a link to the survey for that encore presentation. Again, another way to give us feedback to tell us how we're doing and what education you'd like to see in the future, what you want, what you need. Also tell us in that survey if you'd recommend our education to others. And how likely are you to attend other events that we have? On behalf of myself and Tom and everyone in provider outreach and education, we want to thank you for spending your time with us today. We know your time is valuable. You're all very busy, but we do appreciate your attention. We hope to have you join us on future education. We look forward to your survey feedback, and you may now disconnect.